Pete, you're a beautiful little monster. Yeah. You'll notice that Snoopy is a wingman. I guess that's how I'd like to be in this case. I'm not going to criticize either of the candidates. I think Donald and Hillary, if I may use their first names, have both made lots and lots of mistakes. And I'm not worried who's elected, because each one of them is going to have a whole bunch of problems. And I'm not sure how they're going to handle those problems. After we've had President Obama, we've been left with about $20 trillion in debt. This is pure paper money. It has no value. It has no backing. At one point or another, other countries in the world are going to say, we don't want dollars. And when that happens, you're going to get inflation. It happened in other republics also, whether it was the Weimar Republic in Germany just before World War II, when you talk about the democracies in Rome. Any time you talk about a republic and the printing of money, you've had it also in Argentina, when the value of the money in Argentina basically was worth nothing. So they were either using someone else's currency when they bought things, or they had to get a wheelbarrow full of money in order to buy a loaf of bread. Now, my concern is whoever is president is not going to have the same tools that were available to Obama, because he used them, and in using them left us with debt of $20 trillion. Additionally, he has passed the Affordable Care Act, and that too is now being criticized because they find that the rates of Obamacare or the Affordable Care Act are going to go up 20 to 25%. And that's only the first year. Now, what that leads me to believe is there are reasons for it going up. Obamacare, or the Affordable Care Act, as it is now, doesn't work. Can it be fixed? Possibly. And why would I want to fix something that's as broken as Obamacare or the Affordable Care Act? I want to fix it for one reason. The primary reason is that insurance companies are getting rich, hospitals are getting rich, the doctors and drug companies are getting rich, and we, the public, are paying for it in one way or another. The costs of treatment have skyrocketed, and they're not the best treatments available. The drugs are out of sight. Now, in order to just relate to this one issue, and I'll say today is October 28th, so most people have not voted yet, but there are a lot who have. and I want those to take a look at what we have. Drug companies. American drug companies or foreign companies that sell in America are effectively unbounded. We don't have, as a government, the right to negotiate because members of Congress have been bought off. So effectively, Medicare and Medicaid are paying not what they could bargain for, but what they are paying is a high cost for many drugs because those drug companies know they can get it. And they're getting it from the government for those people who are on Medicare, for those people who are on Medicaid, for those people who are on private plans, because no one is contesting it. Now, I have a simple solution. Actually, I have a few suggestions. It's not a solution, because solution would take a lot longer. One of the things that I find is many drug companies sell the same drugs that they're selling in this country for significantly less than Americans can get the same drugs for. Whether it's something for the knee called Synvisic, where Canada you can go up and get the shots for $300 or $400. If you want the shots in the States, this is something for the knee if you're having problems with cartilage. In America, they can be $900, $1,000, or even more. And the question is, why? And one of the answers is other countries have put limits on the drug companies. And you have to say, why haven't we, as a country, put limits on drug companies? And it would be a simple limit, really, initially. Initially, it would just say that if a drug company is selling the same drug in any other country, take the lowest amount that they're selling it for. Let's say they're selling it in Mexico for $1, and they're currently selling it in our country for $1.50 or $1.80. Take the dollar and say you can't get more than $1.10. So you're giving them a 10% leeway. If they want to sell the drug in this country, they can't charge more than 10% above what they're selling it for in the country where it's being sold for the least amount. That's the first thing. The second thing that I would question is the issue of need and necessity. When drug companies, buy drug companies, and they buy it because they're not doing the research themselves. They're waiting for other companies to develop these drugs, and then they advertise them once they get FDA, Food and Drug Administration approval. Now, the Food and Drug Administration approval costs a small fortune, and one of the reasons it does is, quote, to protect the American public. Now, it appears that it works sometimes, but frequently, by protecting the American public, it drives the costs of these drugs up significantly. Now, how do we get around that? That I don't know. That's something that I would take away from the bureaucrats and leave to the scientists, because obviously the scientists have a better grasp on this issue. So rather than me making decisions as to how much drugs should be tested, because even after they've been tested up to kazoo, doctors still prescribe them what they call for off-label use. In other words, many of the drugs are being used for other than what they were developed. And that's fine because they're functional. So I think that's one of the issues also. So that would handle the FDA. The FDA, for example, has forced some companies to go offshore and to offer treatment offshore. I think I was looking at injections for the knees with stem cells. In this country, they cost about $3,000. But in addition to costing the $3,000, it's not the most effective method, because there are other companies who, yes, they're selling them here for the $3,000, but because of the FDA, they had to go offshore, and they have a method to reproduce the stem cells and then basically inject the solution of these stem cells that have multiplied thousands and thousands of times to make them more potent. And that's been used, and if an American wants to do that, they have to go to the Cayman Islands, which is outside of the jurisdiction of this country, so they'll pay about $17,000 to have this treatment because the FDA has put limits on it. I'm not sure how safe the treatments are, but I think that one of the problems is the FDA, as a roadblock, has put up roadblocks for smaller drug manufacturers, but not for the larger ones, because when you have multi-billion-dollar testing of drugs, that's a lot easier to do for large drug companies than for new startups. And that's why so many new startups with innovative people are sold or taken over by larger drug companies. So I think that's a problem in this country. The FDA certainly is part of that problem, and somehow I think you have a lot of bureaucracy in there that really should be cleaned up. And that's one of the things I'm afraid that isn't being done because of the influence of the large drug companies. So if you have either Donald or Hillary in the White House, if you cleaned up the methods of developing, the methods of costing for Americans for drugs, that would save a significant amount, probably in the billions over a few years, much more than the billions. At one point I did a study and I generated the amounts of savings that could be made over a 10-year period. And in some cases it was in the hundreds of billions of dollars just by making changes in the way drugs are currently prescribed and how they're handled by drug companies. Another issue is, I know I'm on a plan, so what I do is I send the drug requirement, the prescription, or have the doctor send it to an online mail order pharmacy. Now the online mail order pharmacy is a lot cheaper than your neighborhood pharmacy. They don't have the overhead, and for the most part they give you a generic drug or the one that the doctor prescribed if the doctor justifies it. But the mail order process sets up central control so people aren't going to multiple doctors to get drugs. That left people in a position where they overdosed on some narcotics, and that might be a solution, or at least one step in preventing that from happening. But the other thing, it will reduce costs, because, and if you have to see a pharmacist, you can go to your neighborhood drugstore, you can ask a question from that pharmacist. You may have to wait in line, and he may not be as cordial, but eventually he'll speak to you. And I think that's one thing that we have that we're underutilizing. Pharmacists in this country are a great resource, and just as we have nurse practitioners and physician's assistants, pharmacists serve a critical position in our hierarchy that we are not using appropriately. Many pharmacists know a lot more than doctors, know a lot more than nurses, because they've studied the interactions of drugs, and this is being computerized so that pharmacists can be aware of them. The other thing that is available is there are a few web apps that allow a person to look up interactions of different drugs. I don't know if it's 2 or 3, but it's better than having to wait or not being told by a doctor about some of these impacts. So we've talked about the cost of mailing versus going to a pharmacist. We've talked about placing limits on the costs of drugs. That's the second thing. We've talked about the FDA, which is a third thing. Now, I'm sure if I looked into it, I could probably think of many more things to reduce the costs of drugs. But at this point, well, obviously, one of the things to do is to pass laws that allow Medicare and Medicaid to at least negotiate with drug companies, because right now they can't. And why can't they? Probably because pharmacists, pharmaceutical companies have paid off congressmen, just as other companies like chemical companies have paid off Congress, so that we as the American public are paying for it. I think Monsanto has bought several congressmen, both Republicans and Democrats, and because of that they're held harmless if at a later point the genetically modified food, the GMOs, organisms, are found to destroy human health. So effectively they've already bought Congress to say it's not our fault. That doesn't appear to me to be reasonable, and I think the congressman who went along with that and Congress who voted for that has to be questioned. Okay, that was the first segment related to just drugs and how to improve our health system. And I think one of the reasons also for that is our health system takes a huge part of our budget. And if you want to reduce the budget, you look at the different parts. So that's the first one, and that's pharmacies. The second part of any talk about the American health system is you have to ask why services cost sometimes 2, sometimes 3 times as much as the same services in other countries. And some people will say, well, we have redundancy. We have more equipment and more facilities available, so you get to see your doctor or the hospital sooner than you would in other countries. And only part of that is true, because if you go to an emergency room, it's charged to you, and the charge is excessive. It's much more expensive than if you had the ability to go into a doctor's office at whatever time of night you wanted to. Because as soon as you go into an emergency room, you're charged all types of extra fees for the hospital. And although these, quote, are non-profit hospitals, the costs don't look like non-profit to me. The administrators of these organizations, non-profit hospitals, make very, very significant salaries. And although they say they're non-profit, I would question the meaning of non-profit as it's used and how people are paid within these systems. So I think if you take a look at the hospital costs, that can lead to significant savings. In fact, there are some companies who currently audit hospitals, and they audit hospitals because hospitals have a tendency of improperly recording treatment, overcharging for treatment, and the companies who do this usually do it for insurance companies, because insurance companies want to cut down the cost that they pay to the hospital. So that's one thing we can do. We can look at the hospital costs. The other thing obviously is there complicity between the insurance companies and the hospitals? And what that means is if I'm a negotiator from an insurance company, I'm getting a significantly different price than you would if you're a private individual and go into the hospital. So if you're covered by an insurance plan, you may be paying $300. If I'm not covered, I'm going to be paying $600 or $900 for the same treatment. So one must wonder why this happens. The other thing is, those people who are on Medicare, or those people who are on Medicaid and have to go to the emergency room, are billed at the normal rate, not the Medicaid rate. In fact, even in some instances, Medicare treatment is not covered, so some of the things that happen is individuals have to pay over and above what Medicare would pay for their treatment. And it just came up to me in a sense because you can't find out whether you're always going to have a doctor who takes Medicare if you go in for an emergency procedure. So you don't know what an anesthesiologist is going to charge, and you don't know if that's going to always be covered. And if you try to find out prior to surgery, it's almost impossible. Sometimes one of the people at the hospital says, of course they're covered, but you don't get anything in writing. And one of the things I noticed is they now have electronic tablets in many hospitals to ensure that you understand your coverage. Now, I have to see an entire contract to see what's in the four corners of the contract in order to determine what my coverage is. The other thing is, these contracts, as they're printed, use tiny, tiny print. So it's very hard to see and to interpret what those costs are going to be. One point I was having a hernia operation, and after the hernia operation, I was given an abdominal binder. The cost of the abdominal binder was about $110. Now, that's what the hospital billed. I'm not sure what the hospital got for that, but that's what the hospital billed Medicare insurance and my other insurance. If I went online and looked for an abdominal binder of the same type and quality, I'd probably pay about $30 for it. And that would include the shipping. So one must wonder what hospitals are doing that allows them to triple the cost of specific medical devices when you can get them for significantly less than they're available external to the hospital. Now, that's another way I believe that you can reduce costs. It really would take a look at hospitals, the way they're charging, and the way they're charging the government, because if they charge people on Medicaid differently than they charge an insurance group person, then obviously they're getting the money for Medicaid from the state. And when it's from the state, it's from you and from me. So again, huge amount of money that is turned over in the form of hospital care. You have both profit and non-profit hospitals. In fact, the governor of Florida, Rick Scott, at one point was managing a private for-profit, or actually was probably on one of the stock exchanges, but it was a for-profit company. And during testimony, he was advised by his lawyers to plead the constitutional rights not to tell or not to say anything about anything. In other words, he basically was told to plead the Fifth Amendment, where you have a right to remain silent, and you're protected, and the duty to prove that you acted inappropriately, fraudulently, is not on something you say, but it's on something that the government has. Now, obviously, this same thing was done with the Obama administration when you had directors of the IRS who were right under the Secretary of the Treasury plead that they weren't going to respond under advice of attorney. The same thing happened when you had the administrator for the Clinton email services. He too was advised by his attorney not to say anything. And I think one of the problems is, yes, there are times when someone who's in a position of trust, public trust, has a duty to function differently. And the only thing I can suggest is hit the pensions and the retirement. Now, obviously, I wouldn't want someone who worked for a government for 25 years to be cut off entirely from their pension unless they acted criminally. And you're not going to find out if they acted criminally if the lawyers tell them to keep quiet about it. But there are in-between steps, and there's certain grants of immunity for a percentage of their pension. These are things that the new executive should look into. So now we've talked a little bit about the hospitals, the government interfaces, the confidentiality. Now, one of the other things is doctors. There are a lot of doctors who are no longer taking Medicare, Medicaid, or people who are covered by the Affordable Care insurance companies because they don't think they're going to get paid. And the result this time is we've had to up the fees for insurance as much as 25%. The average family can't afford that. So again, I think the Affordable Care Act is not dead, but it's slowly dying. But if one has to set up the same procedures again, it's going to duplicate the cost. So whoever is elected, whether it's Hillary or Donald, what I would suggest is trying to use whatever segments of the Affordable Care Act that you can, so it doesn't have to be done again. But again, there are lots of changes that are required. One of them has to do with the way drug companies are paid and the cost of the drugs. Another one has to do with the way hospitals are paid and who pays for what. Third one might be to set up other than an emergency room. And I know I see different places that are open now. It's aftercare, which basically is a facility where there's a doctor present during 24 hours, so that when your regular doctor isn't available, you can go to an aftercare facility before going to an emergency room. The reason is aftercare facilities are a lot less expensive than hospitals and emergency rooms, where the hospital and emergency room tack on a certain amount of costs which you wouldn't pay if you went to an aftercare facility. So that's another area that obviously can be changed. What I'd like to do at this point is realize that I want to stop, and I'll come back later and possibly talk about some of the ways to improve how the medical profession functions. And I'm not a doctor. Some doctors will be very critical, but there are current hospitals and current medical groups where they're functioning at a different level and they're functioning more effectively. Hello, I'm back again, and I'm going to raise an issue because, hospitals have to have the latest and greatest types of machines around. And that's fine, except if you're going to have that latest and greatest machine, you have to distribute the costs of that machine in the best way possible. And let me give you an example. When I was living in New York City, I needed to have MRIs taken of certain bodily parts. And that was okay. And I called up a series of independent places that did MRIs. And there are groups all over the country, whether it's Simon Med or any of the other large private companies that take blood tests, that take MRIs, and that do other tests that are currently done in the cardiologist's office or in another doctor's office. And there are duplications all the time because each doctor, when he does something, can justify a cost and a reimbursement from Medicare. And that's something that upsets me, but that's not what I'm going to talk about now. In New York, I had to go for an MRI. And although I wasn't directed by my insurance company, I asked one of the companies who was doing independent MRIs when I could go in for an MRI. So they said, well, we're open 24 hours. I said, oh, and what's the difference? He said, well, if you come in other than between 9 and 5, the cost of doing it is less expensive because that's not when we're busy. So we have off hours, and during those off hours, we reduce the cost in order to utilize a machine, which is one of the most costly parts of many of these procedures. So, in other words, if you go in from 9 to 5, it might cost you $1,000, or your insurance company $1,000 for the MRI. If you go in at 8 p.m., instead of $1,000, they may charge your insurance company $600. That's a 40% reduction for doing it 3 hours later because no one else wanted to come in at 8 p.m. Similarly, if you wanted to do it at 11:30 or 12:30 p.m., instead of being $600, it was $400. So instead of paying the $1,000, you were paying the $400, which is 60% different. Now, how can they do this? They do it using something called economy of scale. Economy of scale says you're using the same equipment that has a base cost, which in this case might be $1 million. And each time you use a machine, you get something back for it. Now, the more frequently it's used, the more you get back from it, even when you consider maintenance to the machine and everything else. The only cost that increases usually is the labor cost, which the person has to operate the machine. But the cost of the machine itself doesn't change. You might have minimal electrical costs to run the machine, but again, you're using the basic machine, and if you're charging $400 rather than $1,000, you're still making a profit. So the question is, why aren't these types of facilities available in other cities, states, and towns? I don't know. but it was a way that I thought to reduce medical costs. I think that's economy of scale, because you're just getting more things done during the same period of time. If a machine is sitting idle in a hospital for a long period of time, it's not being utilized and you make nothing. If you're making $400 to use it at 11:30 at night, that's $400. So you're getting enough to pay the technician and any usable stuff that you have to use, but that's one way I see of reducing costs. And let me stop there. And I'll try to get onto this because there are lots of other areas that the new president will have to work with. And currently, that's not happening. Pete, you're a beautiful little monster. Yeah.